unfortunately, the United States is one of the worst in terms of maternal outcomes in the developed countries, and our outcomes are not getting any better. The top causes of morbidity and mortality among pregnant women include hypertensive disease of pregnancy, hemorrhage, infection, cardiac disease, and mental illness. So these are some of the reasons why our mamas are not doing well during the pregnancy, but also in the postpartum period. It turns out that about 50.6% of maternal deaths that happen in the United States are in the postpartum period, and the majority of them happen more than 48 hours after delivery. So that includes the whole time between delivery and the 1 year after delivery. So mental health is very important for me, and that's why I spend a little bit more extra time with those answers, but also making sure that we address issues that arise with pregnancy, such as hypertensive disease, and watching out for any cardiovascular risk factors. Common symptoms that I discuss with patients are the signs or symptoms of preeclampsia, which I tell my patients to look out for, especially in the second and third trimester. Preeclampsia usually does not develop prior to 20 weeks and usually develops later in the pregnancy or 28 weeks. But I always screen for these symptoms and ask them to let us know if they develop them. So headaches are persistent, meaning that they have slept, they've eaten, make sure they're well hydrated, they're taking Tylenol and they don't go away, or they're associated with changes in their vision, like blurry vision or floaters. Any chest pain or difficulty breathing, and I'm not talking about feeling short of breath because you're 38 weeks pregnant and going up the hill. Everyone will feel that, but especially shortness of breath when you're at rest, meaning you're not exercising and still having difficulty catching your breath. Swelling that is persistent. Some swelling is normal in pregnancy in the later trimester, but swelling that occurs suddenly and is present despite elevating in the feet and in the morning, that is not as normal. And so if any of those symptoms were to happen, to contact their provider. Yeah, it's interesting because diabetes is not necessarily one that women develop any symptoms to, or just hypertension on its own is even outside of pregnancy, we call them the silent killers, right? Because they don't necessarily manifest with symptoms. And so that's why we screen. We do the testing and we do the blood pressures. And so patients may not realize this, but every time they come to the clinic, we screen them for diabetes and preeclampsia or the complications of hypertension by dipping their urine and looking for any protein in their urine or glucose in their urine. We also screen by doing the blood pressures and then making sure that their baby's growth is appropriate by measuring their fundal height or their belly. So we're constantly screening for these things because not everyone develops symptoms, but if you notice that you're constantly thirsty by drinking enough water, or you're feeling that you're going to the bathroom frequently, just without any other symptoms, or your belly feels bigger than previous pregnancies, that might be some of the signs of diabetes. But again, these are not very common to be displayed in pregnancy, and going to the bathroom frequency is very normal in pregnancy. So sometimes it's hard to differentiate between an abnormal symptom and one that is normal. So that's why we screen for these things all the time. Even as an OBGYN, all the knowledge that I have in my first and recent pregnancy, I had a little bit of that. I think is very normal. And so luckily there's a lot of resources out there, even though sometimes poo-poo on the internet, but there are a lot of good resources and you have your provider. So one of the things that I always encourage my patients is I try to identify a evidence-based resource for you to go and see, is this normal or this is not, that can walk you through all the different phases of pregnancy. Common book that people use and is available, I believe, online is What to Expect When Expecting. So things like this are very important to kind of read a little bit about what is normal and when to ask questions. But I always encourage patients I encourage them to ask questions, because it is easier for me to reassure someone than to miss something that was important and then being able to go back and figure out when it started. Feeling comfortable asking questions is always very important. I mean, in order to get to where I am, I have to do a very rigorous training. I did, after medical school, 4 years of residency specializing in OBGYN. And so I spent many hours a day, a week on average of about 100 hours. Don't tell that to anyone, but week, just learning about how pregnancy works and how the female body works. And now that I'm done with training on a daily basis, I see many patients. And so there are patterns that are known to be, normal in pregnancy. And so I feel that it's easy to reassure. It's because of that knowledge, it's because of that background that I feel confident when and when not to reassure a patient. When I think that something is a little bit out of the norm, then additional testing is ordered if indicated. So it comes from this experience of seeing and taking care of a lot of women. And now I can say also as a mother that I've gone through it, that brings some of that validity. Although not all of my colleagues can say that, especially the male ones. But it mostly comes from our years of training and of years of being and taking care of patients.